If you're someone who has struggled with severe acne, you're likely familiar with isotretinoin. Isotretinoin, also known by the brand name Accutane, is a powerful medication that can effectively clear up stubborn acne. However, before starting treatment, it's essential to understand the potential benefits and risks. In this comprehensive guide, we'll delve into everything you need to know about isotretinoin, including how it works, the potential side effects, and what to expect during treatment. What is isotretinoin? Isotretinoin is a retinoid medication that is derived from vitamin A. It is typically prescribed to treat severe nodular acne that has not responded to other forms of treatment. Isotretinoin works by reducing the production of oil in the skin, which can block pores and lead to acne breakouts. By decreasing the amount of oil produced by the skin, isotretinoin helps to prevent the formation of new acne lesions. Isotretinoin is available in several different forms, including capsules, gels, and creams. The most common form of isotretinoin is a capsule that is taken orally. Isotretinoin is a prescription medication, and it is only available through a healthcare provider. How does isotretinoin work? Isotretinoin works by reducing the production of oil in the skin. Oil, also known as sebum, is produced by glands in the skin called sebaceous glands. When too much oil is produced, it can mix with dead skin cells and clog pores. This can lead to the formation of acne lesions. Isotretinoin works by reducing the size and activity of the sebaceous glands in the skin. This helps to decrease the amount of oil produced by the skin, which can help to prevent the formation of new acne lesions. Isotretinoin also has anti-inflammatory properties, which can help to reduce the redness and swelling associated with acne. Benefits and risks of isotretinoin. Isotretinoin can be an effective treatment option for severe nodular acne that has not responded to other forms of treatment. In clinical studies, isotretinoin has been shown to clear up acne in up to 90% of patients. However, isotretinoin also comes with potential risks and side effects. One of the most significant risks associated with isotretinoin is the risk of birth defects if taken during pregnancy. Because of this risk, women who are pregnant or planning to become pregnant should not take isotretinoin. Other potential side effects of isotretinoin include dry skin, dry eyes, nosebleeds, joint pain, and an increased risk of sunburn. Isotretinoin has also been linked to an increased risk of depression and suicidal thoughts, although the risk of these side effects is still being studied. Who should take isotretinoin? Isotretinoin is typically prescribed for people who have severe nodular acne that has not responded to other forms of treatment. It is usually not prescribed for mild to moderate acne or for acne that is not causing significant physical or emotional distress. Before prescribing isotretinoin, your healthcare provider will likely conduct a thorough evaluation to ensure that isotretinoin is an appropriate treatment option for you. This evaluation may include a physical exam, blood tests, and a discussion of your medical history and any medications you are currently taking. Preparing for isotretinoin treatment. If your healthcare provider has prescribed isotretinoin, there are several things you can do to prepare for treatment. First, make sure you understand the potential risks and side effects of isotretinoin. It's also important to discuss any questions or concerns you have with your healthcare provider. Before starting treatment, your healthcare provider may also recommend that you undergo a pregnancy test to ensure that you are not pregnant. Women who are pregnant or planning to become pregnant should not take isotretinoin. You may also need to discontinue any other acne medications you are currently taking before starting isotretinoin. Your healthcare provider will provide you with specific instructions on how to prepare for treatment. How to take isotretinoin. If you are prescribed isotretinoin, it's essential to follow your healthcare provider's instructions closely. Isotretinoin is typically taken orally in the form of capsules. The dose of isotretinoin you are prescribed will depend on your weight and the severity of your acne. Isotretinoin is usually taken once or twice a day with food. It's important to take isotretinoin with food to help improve absorption and reduce the risk of side effects. During treatment, your healthcare provider may also recommend that you avoid certain activities or medications that can increase the risk of side effects. For example, you may need to avoid waxing or laser hair removal treatments while taking isotretinoin. Side effects of isotretinoin. As with any medication, isotretinoin can cause side effects. Some of the most common side effects of isotretinoin include dry skin, dry eyes, nosebleeds, joint pain, and an increased risk of sunburn. These side effects are usually mild and improve with time. More severe side effects of isotretinoin can include an increased risk of depression and suicidal thoughts. While the risk of these side effects is still being studied, it's important to discuss any concerns you have with your healthcare provider. Coping with isotretinoin side effects. If you experience side effects while taking isotretinoin, there are several things you can do to help manage them. For example, using a moisturizer on your skin can help to alleviate dryness and flakiness. Similarly, using artificial tears can help to alleviate dry eyes. If you experience joint pain or muscle aches, your healthcare provider may recommend that you take over-the-counter pain relievers such as ibuprofen or acetaminophen. Isotretinoin and mental health. Isotretinoin has been linked to an increased risk of depression and suicidal thoughts. While the risk of these side effects is still being studied, it's important to discuss any concerns you have with your healthcare provider. If you experience symptoms of depression or suicidal thoughts while taking isotretinoin, it's important to seek medical attention right away. Your healthcare provider may recommend that you discontinue isotretinoin or switch to a different medication. Isotretinoin and pregnancy. Isotretinoin is known to cause birth defects if taken during pregnancy. Because of this risk, women who are pregnant or planning to become pregnant should not take isotretinoin. Women who are taking isotretinoin should also use effective birth control to prevent pregnancy while taking the medication. This typically involves using two forms of birth control, such as a hormonal contraceptive and a barrier method like condoms or a diaphragm. Isotretinoin and other medications. Isotretinoin can interact with other medications, so it's important to discuss any medications you are currently taking with your healthcare provider before starting isotretinoin. In particular, isotretinoin can interact with medications that contain vitamin A, such as other acne medications or supplements. It's important to avoid taking these medications while taking isotretinoin. Isotretinoin and diet. There is some evidence to suggest that a diet high in vitamin A can increase the risk of side effects while taking isotretinoin. However, there is no definitive evidence to support this claim, and more research is needed to determine the relationship between isotretinoin and diet. Conclusion. Isotretinoin can be an effective treatment option for severe nodular acne that has not responded to other forms of treatment. However, it also comes with potential risks and side effects. Before starting treatment, it's important to understand the potential benefits and risks of isotretinoin and to discuss any concerns you have with your healthcare provider. If you do decide to take isotretinoin, it's important to follow your healthcare provider's instructions closely and to take steps to manage any side effects that may occur. With the right preparation and care, isotretinoin can be a game changer for severe acne and can help to improve your skin and your quality of life. Thanks for watching.